Welcome everyone to our special broadcast as we approach the World Anesthesia Day. On this special episode, we are exploring how the skills honed in an operating room can transform a nation's healthcare. Our guest today is a true visionary, Dr. K. Hari Prasad, the current Group Chairman of Quality Care India Limited. Dr. Hari Prasad is widely celebrated as a pioneer of emergency medicine in India, building the entire system from the ground up when the concept was non-existent. He started the first dedicated emergency hospital and created a network that became the national model. He then rose to become the president of a 10,000-bed Apollo Hospitals division, guiding it through a period of phenomenal growth and navigating the COVID-19 crisis. But for the foundation of this incredible journey was a specialization in anesthesiology. Today, we'll learn how the precision and crisis management skills of an anesthesiologist shaped a career that has made an indelible impact on Indian healthcare. Welcome aboard, sir. Welcome to the special podcast.
Thank you, Meera. It's always a pleasure to be on the platform.
Yeah, thank you, sir. So, born into a medical family, was a career in medicine always your destiny, or did you consider any other path?
No, right from my childhood, it was drilled into my mind that I would always be a doctor, starting with my grandparents, my parents, everybody. It was literally drilled into my mind that I would always be a doctor, and that was the only career option. I never thought about any other option as a career at any point of time.
What made you choose anesthesiology? So, what gave you that perspective that you need to do anesthesiology?
In those days, once I finished my MBBS, the glamorous subject at that time was orthopedics. I wanted to do orthopedics, but my father sat me down and said, "You have this hospital which the dad had started many years ago." He said, "If you become an orthopedic surgeon, you would be able to handle only the orthopedic cases that come to the hospital. But if you actually do anesthesia, you'll be able to be a part of the treatment process for all surgical procedures. And then you would be able to do a lot more than just anesthesia in terms of critical care and intensive care and stuff like that. So you would be more suited to do anesthesia." So he guided me into the specialty. Although orthopedics was my choice, so I heeded to his advice, and I'm glad that I took up anesthesiology as the specialty.
So you pioneered emergency medicine when the concept was non-existent in India. What specific event ignited this passion in you, sir?
I was always supposed to be taking care of dad's hospital, and that was supposed to be my career path. But somewhere, Dr. Reddy, somewhere in '96, Dr. Reddy, the chairman of Apollo Hospitals Group, and Miss Sangeeta Reddy called me and said, "Join the Apollo Group." I was wondering, wow, I had my own hospital, and I told him that. And then one thing which he said, which made me change my mind, was that if I continued with the dad's hospital, I would be impacting only the community around the hospital. But Dr. Reddy said he had plans of going all across the country and internationally, and it would be an opportunity to impact a much larger cross section. So that's how I joined Apollo. And he had, as a practicing cardiologist from the US, had relocated to India to bring what's available in the best institutions in the world to India. And at that point of time, emergency as a specialty was non-existent in the country. So the first real challenge that he gave me was to start the specialty in the country, and that was the initial reason why I got into emergency medicine. And probably the skills of an anesthesiologist helped in shaping the specialty and growing it.
True, sir, absolutely. You once worked as a paramedic to prove the system's value. Is there any story you would like to share? Why it was needed?
Yeah, we started this probably the country's first dedicated accident and emergency hospital in Hyderabad. It was a small 50-bedded hospital. And in those days, there were no paramedics trained in emergency medicine. There were no doctors trained in emergency medicine. So I was lucky to have the support of 5 or 6 other anesthesiologists who all joined me in that hospital. And we became the paramedics, we became the nurses, we became the emergency physicians, we became the anesthesiologists, we became the intensivists. So we did all the jobs that was required because the skill sets for all the jobs were more or less similar for of that of an anesthesiologist. And these people who were paramedics were not available. So we actually got into the ambulances and went into pick up sick patients and start stabilizing them, and that's how the whole story started. Subsequently, we got training programs for paramedics and doctors, and I'm glad that we've been able to create an initiative where emergency medicine as a specialty not only is an established specialty now, but is also a much sought after specialty at this point of time.
It's a very inspiring story, sir. So you rose from a clinician to the president of a 10,000 bedded hospital. How did you navigate that major transition?
Now, once emergency systems were in place, and it took about 5 6 years, Dr. Reddy slowly and Mrs. Sangeeta slowly pulled me into administration. And the first hospital that I was given responsibility of was the Hyderabad Jubilee Hills Apollo Hospitals. And from there on, all the newer hospitals which started coming into the group came under my region. And slowly it became known as the Central Region, which had almost all the other hospitals of the group except the Delhi and Chennai group of hospitals. And then in 2016, Dr. Reddy said that you're taking care of almost all the hospitals except Chennai and Delhi. It's time you start taking care of these two also as a group president. And that's how I took on the responsibility of a group president. So it was more non academically trained clinician whom Dr. Reddy and Mrs. Sangeeta actually nurtured into an administrator. That was the story of the transition.
Sir, Apollo's stock price soared under your presidency. What key business strategies drove that incredible growth?
I think one of the primary things was Dr. Reddy. He always said the patient comes first at a point of time when nobody was looking at quality of care and systems and processes and stuff like that. And he always said that patient, irrespective of how many beds you are growing, what revenue you're getting, and whatever is happening on the other side, you should look at the first thing is the clinical outcomes and then the patient satisfaction. Once these two are in place, these are of paramount importance. The rest follow. And that was the guiding principle. And actually, it happened that way that we were focusing completely on clinical outcomes and patient satisfaction, and the numbers, the revenues and margins and EBITDAs followed. And that was the reason why the share price went up so high.
So during COVID, Apollo had no supply shortages, though the whole country was saying about shortages of at every level. And we treated the maximum number of patients. What was the secret to this resilience?
I think it was the one Apollo had one of the strongest supply chain management system in the country even before COVID, and its geographic spread across the country actually gave it access to resources across the country. So if there was a shortage at one place, we could always get the stuff from the other place and help the units which needed where there was a shortage and needed help. And COVID was a tough period, and you were all part of the team which actually provided services to the patients. And as an administrator, my challenge was to actually keep all the staff safe because they were actually working with the COVID patients, and provide them with the infrastructure and the medications and stuff like that which were required for treating the patients. There were multiple incidents where we used to get calls in the middle of the night where some hospital was running short of oxygen, some was running short of medications, some were running short of beds. So there were multiple occasions where this happened during the COVID period. But I think the group stood up, and one of the reasons the group stood up at that point of time and was the doctors, the nurses, and the entire team which worked across the system in a very brave manner, in a committed manner. And I think whatever Apollo could do was because of the team of providers which it had and the commitment they showed.
Absolutely, sir. From the top management to the leaders like you, it has always been a pleasure working in Apollo, sir. So your autobiography is titled I Am Possible. What is the central message you wanted to share with your story?
Actually, I had a habit of actually, putting down everything that happened in a small diary. Somewhere around the time, just after I became the president of the group, I was diagnosed with a sort of leukemia. And at that point of time, my son read all the things that happened that were mentioned in that, and then after, what happened during the course of my treatment and after. And he said we should convert this into a book. And I said, I don't have the patience to do it, nor I have the inclination to do it. But he worked with a publisher, and they actually got converted that rough notes or rough whatever was there on the diary into a book. And it was they who actually came up with the name I Am Possible, because of the number of turns, twists, and highs and lows that I went through in life. So that is how that name I Am Possible came up.
Glad you did, because it's a very inspiring story. It's going to help a lot of other people. Anesthesiologists are like pilots. Did you use any cockpit management style when you were creating the first EMS protocols?
No, all through, I think one of the important attributes an anesthesiologist naturally develops during the course of training and during practice afterwards is to become a natural leader in the operation theater. It is the anesthesiologist is the fulcrum around which everybody revolves within the operation theater, and everything revolves around the anesthesiologist. Unfortunately, the surgeons are the more glamorous and more known entities in a hospital scenario, but in the theater, it is always the anesthesiologist who makes the difference and who is the leader. So I think inherently anesthesiologists have some sort of a leadership qualities which would be there in them, and that those qualities have actually helped many. I know a lot of people who are by training anesthesiologists, practiced anesthesia, and then moved on as good hospital administrators. The training and the specialty itself has a role in creating leadership positions.
True, sir. True. I completely agree. So, in retrospect, was anesthesiology the perfect choice for your diverse career path?
I think so, because one, I talked to you about the role of an anesthesiologist in the operation theater, and the second thing is about the skills of an anesthesiologist. In those days, as I told you, there was no emergency medicine, and the clinical skills that were required for a critical situation for a patient, to revive a patient, to resuscitate a patient, to stabilize a patient, were all a part of the training of an anesthesiologist. And there was no critical care, was just about beginning at that point of time. And even intensive care units were managed best by the anesthesiologist at that point of time. So clinically, yes, the training that an anesthesiologist gets gives him a lot more diverse exposure in terms of what he can do for a critically ill patient. And the second part of it is it also gives you a chance to understand other specialties much better, because you work very closely with all the surgical specialties, and in the intensive care unit with all the medical and surgical specialties. So when it actually gives you that sort of an opportunity to understand them better, all this transforms into a good knowledge base when you take up leadership positions in the hospital, because you're not managing one specialty or one operation theater, you're managing the entire ecosystem.
That your objective was make a difference in healthcare. What is your greatest contribution to that goal so far?
I think looking back, initiation of emergency medicine and seeing it the way it has evolved in the country, I think that's been a great satisfaction. And to be, I think I've been very lucky to have been a part of that. The second thing is the growth of Apollo hospitals as a system. I joined it when there were 3 Apollo hospitals, and when I retired last year, it was 72 hospitals. So the growth of the system itself is a great satisfaction, and I think I learned a lot during the entire journey of the 28 years I was with the Apollo hospitals. And then it helped me evolve not just as a clinician or an administrator, but also as a human being.
After Apollo, what has inspired your new role as a group chairman at Quality Care Hub?
Yeah, and having done what I'd done at Apollo in a very active executive role, I was retiring, and I was looking at this opportunity came up as a because Blackstone, which is one of the largest global private equity companies, got into healthcare, and they had bought up three groups of hospitals. One is the Care group of hospitals, second is Kim's Health in Kerala, and third is Evercare in Bangladesh. So they had invested into healthcare, and they were looking for a chairman for that position. I was very happy to take it up because it was. I thought would give me an opportunity to use some of my learnings to mentor people, help people, guide people, and that's the reason I took up that role.
What advice would you give clinicians who, like you, want to transition into high level management roles?
I think management role is not as rosy as many people would look at. A lot of people who actually do not, are not completely exposed and do not have the in-depth understanding of what goes into hospital management find it to be very glamorous and find it to be, very cushy role to get into. But let me tell you that healthcare is one of the most dynamic and most complex environment because things can change in minutes, and you could be actually handling a big huge crisis with no warning at all, and then you're actually dealing with a diverse set of people. You have this highly qualified cardiothoracic surgeon with many years of experience, and on the other hand you have the porters and you have the security, and the entire chain has to work in unison to see to make sure that the patient is safe and the clinical outcomes are good and patient is satisfied. So it's a very very diverse and complex environment, so it keeps you on your toes, and it is definitely not an easy thing or a glamorous thing as people look at. It gives you back once you've done it, it gives you back a huge amount of satisfaction that you were able to contribute something to not just the patients whom you treat, but much beyond that.
So you've received lifetime achievement awards in emergency medicine. Do you still identify as an anesthesiologist at heart? Because you're so
I'm
much diverse.
always an anesthesiologist at heart, and I think that's been my first clinical love. And I always say that that anesthesiology was the foundation of not just my clinical career, but also my administrative career in life.
That's really nice to hear. So, what would you tell a young doctor today choosing to specialize in anesthesia about the future in this field?
I think it's huge. From the days we trained in anesthesia to what's happening today, there has been a transformation in the way anesthesia is delivered, not just in terms of technical skills. There's a huge amount of technology which is coming. The pharma sector is coming in a big way. So actually, apart from making it much safer, much less risky for the patient, I think there is a lot of excitement in anesthesia. And I think the newer innovations and with AI and all that also making an entry into anesthesia, it's going to be a very exciting field. And I think I would advise the younger doctors who are coming into the field to keep their minds and ears open for new things.
Definitely, sir. How do you think anesthesia department, because it's a non-revenue generating, how do you think we should articulate and value this strategically and as a financial asset to any hospital?
I don't think it's a non-revenue generating. I always looked at it as a bigger revenue generating asset than anything else. Well, I tell a lot of people it's very difficult for a surgeon to kill a patient in the operation theater, but and majority of accidents which happen in the operation theater are because are anesthesia related. So there's a huge cost to anything which goes wrong on the anesthesia front compared to anything else. So it's actually not a cost head, but I think it's a revenue head. And I think anesthesiologists have not now come far beyond the confines of an operation theater into multiple areas like, and just to give you an example, pain management is a huge area now today, and it's a completely subspecialization of anesthesia, critical care, emergency. There are multiple areas where anesthesiologists are now working beyond the four walls of an operation theater. So actually, it should not be, never be considered costed. It should always be looked at as a revenue.
What role do you think telehealth or remote monitoring will play in the future of anesthesia and critical care?
I think not just remote monitoring. I think remote surgery is happening today. We're using robots and telehealth, and I think the day is not far off when remote anesthesia can be given from a distant location. Monitoring is a much simpler thing, simply because you get the data, you get the entire thing on a screen, and you see it and advise people at the other end. But I think it's going to go much beyond that, and now with AI making a entry into the specialty, I think it's going to be much more exciting.
Sir, on this World Anesthesia Day, what is your message to anesthesia colleagues across India and the world?
I think they should be extremely proud of what they do, and they should actually celebrate what they're doing, because we don't need others to celebrate what we're doing. We need to celebrate what we're doing, because we should take pride in what we're doing, because it's truly outstanding, and it's truly something which has made a lot of things which are talked about possible today. If complex neurosurgery is possible today, if complex cardiac surgery is possible today, if cardiac transplantation is possible today, it's all because of anesthesia, and that pride should always be there with an anesthesiologist and should be celebrated.
What is one thing you wish every patient understood about the person behind the curtain? That is their anesthesiologist.
I think the lay person should know that the most critical person while they are undergoing surgery or while they are in the operation theater is the anesthesiologist. And while they spend a lot of time and effort in choosing a surgeon, they should make sure that they are in the hands of a safe anesthesiologist while they are in the theater. And I think it is their right.
Thank you so much for your time. It was a pleasure speaking to you and understanding the ideology behind all that you've been doing. It was a wonderful journey you've been through. Thank you so much, sir.
Thank you, and a happy World Anesthesia Day to you and rest of the colleagues across the world, and all the very best.
Thank you, sir. Thank you so much.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.